Hey guys, Dr. Jordan Miller here with Integrated Health Solutions, and for today's video we're going to be discussing the pigeon stretch. Now the pigeon stretch can be done a couple different ways and a few different positions. We're going to go over the seated variation of how to do that today. This is a very common stretch or exercise that we give to almost all of our patients, especially those that have back-sided, let's say lower back, kind of upper hip or glute, or even sometimes some leg tightness. Now in today's day and age where we spend so much time in a seated position, we're spending a lot of pressure and weight kind of compressing down onto that backside of our hip and our glute muscles. So this is a really good stretch to open up and stretch that backside of the hip and the glutes, but it also pulls a little bit into that lower back and even sometimes that outer portion of the leg as well. So you're going to begin in a seated position, preferably something that keeps the hips and the knees in about a 90-degree angle. And whatever hip or side of the back you're trying to stretch, you're going to begin by moving that leg. So you're going to elevate the outside of that foot and ankle onto the top of the opposite knee. Now, I like to grab a hold of the ankle just to make sure this leg is stabilized so that way it doesn't end up slipping off. And then with the other hand, applying just a little pressure down onto the knee so you kind of open up that hip joint. Now you want to keep the chest and the upper body nice and tall and straight. Make sure that your body is nice and neutral. And then imagine, what I tell my patients is you have a string on the center of your chest and somebody is just pulling you towards them. So what you're doing is you are leaning the body straight ahead. Fixate your view on something in front of you so that way you don't end up bringing your body down. The goal of the stretch is not to bring your chest towards your leg. You want to keep your body upright and hinge at the waist without sacrificing that middle back. Meaning when you're bending, you don't want to see this motion or rounding in the back. You want to see a nice tall upper body and a hinge at the waist until you feel that traction throughout that posterior chain back here. Now, what's a little struggling for most patients is as we evolve in kind of age and we get a little bit older, our bodies are stretched differently. You know, when you're younger, getting ready for sports events, it's 10 seconds of a really high, really intense stretch. Now we want to shift that. So once we get older and we're not as active, we want to decrease the intensity of that stretch. So I don't want you stretching to the point of pain. Think of a scale of 1 to 10, maybe about a 4 or a 5 at most, but not to the point where you're grimacing and it's visible how uncomfortable the stretch is. Plus, you want to hold this for about 30 seconds minimum. If you want to go 45 or 60 seconds, that's great. But also remember, we have to then do the other side as well. So we're going to bring this leg up, leverage the hip, upper body nice and tall, and same thing, lean forward by bending at the waist, feeling that stretch on the back side. Give it maybe a solid minute or so on each side, and you can do this whenever you want through the day as long as you are in a seated position. And as long as your leg feels stable, once you're in that position, you can continue to do whatever you're doing, whether that's work, whether that's on your phone, eating dinner, watching TV. You can multitask, so this feels a little bit less like a chore and just something proactive you can do throughout the day as well. So try it on your own, comment any questions or concerns below, and we'll see you next time, guys.